Hi and welcome back to my channel. I want to say a big thank you to everyone for liking and for subscribing to my channel. Thank you to all those who also commented. Please keep the comments rolling in, keep the subscription going in. Okay, so today we'll be talking about diabetes mellitus. Okay, so diabetes mellitus, commonly known as diabetes, is a metabolic disease in which insulin in the body no longer works. Insulin is a hormone which helps in regulating blood sugar by moving blood sugar from the blood into the cells so that it could be stored or used as energy. Okay, but when a person has diabetes, this particular function doesn't work anymore. Let's go over to types of diabetes. One, we have type 1 diabetes. Second one, type 2 diabetes. Third one, pre-diabetes. Fourth one, gestational diabetes. Okay, so let me explain, beginning from the first one. Type 1 diabetes, this is an autoimmune type of disease that suddenly begins to attack the blood cells. Okay, so this same condition causes your kidneys to remove too much water from your body. Okay, now let's go back up a bit to gestational diabetes. Note that gestational diabetes is asymptomatic, and when I say asymptomatic, I mean it does not show any symptoms. Okay, so you can only discover gestational diabetes when you do the normal fasting blood sugar test or glucose oral test. Okay, so let's go to the general symptoms of diabetes now. So we have increased hunger, increased thirst, delay of healing in wounds. You also have frequent urination, okay, blurry vision, extreme fatigue, and weight loss. For the men, in addition to these general symptoms I've just mentioned, they will have erectile dysfunction or poor muscular strength. So if you're a man and you've noticed these specific symptoms for men and the general symptoms, please go and take a sugar test. It's not expensive. In some places, it might even be done free of charge. For the women, in addition to the general symptoms, they will also experience UTI, that is urinary tract infection, and itchy or dry skin. Okay, so causes of diabetes. As I mentioned earlier, type 1 diabetes really doesn't have a cause, or should I say the cause is unknown. The reason why it suddenly begins to attack the immune system and then attacks the pancreas where insulin is made is still unknown. For type 2 diabetes, is caused by genetic factors, which means maybe diabetes runs in the family of that particular individual. For gestational diabetes, is caused by some hormones during pregnancy. As I said before, these hormones make the blood sugar level to start increasing, and then in a while the insulin starts, the hormone starts to block the insulin. Okay, for pre-diabetes, it could also be genetics and lifestyle of such an individual. So actually, kids or young adults could have type 2 diabetes. So it is very, very crucial and important to watch what your children eat and watch the lifestyle of your kids from an early stage. Since in our present or modern day and situation, a kid could eat a lot of sweet things and tend to become obese. It is good to watch what your children eat. Don't let them have too much of sweet things, and then also let them engage in sports activity. Okay, so let's go to some other causes of diabetes. Now, like I said earlier, lifestyle factors like maybe physical inactivity. For example, some people say, oh, my kids, this one is not athletic. Fine, your kid is not athletic, but you can help your kid groom that particular athletic nature by allowing them to participate in one or two sports activity. For example, inter-house sports in schools. This activity is good for your children because it helps one keep fit. Also, exercise. Daily exercise is recommended and is also very good. Now, genetic factor. Okay, like I said earlier, I've explained genetic factor, that such an individual may have diabetes running in his bloodline. Okay, so we have some other risk factors to diabetes. Diabetes may become extremely dangerous if left for a very long period of time without it being discovered. For example, a person who has stroke, or let me say a pre-existing medical condition, should be careful and always run frequent checks to know if he or she has diabetes. Because when these two separate diseases come together, it's going to be a disaster. You have a pre-existing medical condition like high blood pressure, and then you have diabetes too. Or maybe you have heart disease, and then you also have diabetes. Just imagine such. No, that will not be really right. Okay? So, treatment of diabetes. We have various treatments and management for diabetes. Now, why I say management is because in some cases, diabetes do not just disappear. Okay? It doesn't just disappear because you were giving drugs or medication. You have to manage this diabetic situation and curb it before it develops further. Okay? I mentioned exercise, physical activity. When you engage in lots and lots of physical activity, it could help you manage the diabetic level. Sometimes physical activity might not be enough to manage or treat diabetes. Your doctor might also recommend some drugs or additional medication for you. Okay? Those drugs like DPP, they could help you. I know maybe some drug company names have like glucophage and others. So if you get those drugs on prescription of your doctor or your pharmacist, together with the physical activity, it will help you treat and manage diabetes. Now, insulin, we know that I've explained earlier that insulin is a hormone, but sometimes we have insulin in shots. When I say shots, I mean injections. Insulin that is actually an injectable. Okay, so we have rapid acting insulin, fast or short acting insulin, intermediate acting insulin, and long acting insulin. Now, these insulin shots, when each of them is given, has a specific time frame it takes for it to work. Okay, so with this, we've come to the end of today's edition on diabetes. Please ask questions, drop your comments down at the comment section. Remember to stay safe, stay healthy. This is a time for you to engage in more physical exercises and bond with your family. God bless you.